started, and here is your question. I normally give 1 minute to read the question. Right, so if you have read and understood, considering that history taking station, kindly begin.
Good evening. I'm Dr. Kolade, one of these candidates for this exam. Can I confirm your name and age, please?
Yeah, it's Hassan 32.
Okay, all right. And I would like to take history of what's brought you to hospital today. Hope that's fine by you.
Yeah.
Okay, all right. Thank you. Yes, I was told that you had a swelling on your right groin. For how long has this swelling been?
Yeah, doctor. It's there like maybe more than 8 months.
8 months. So, what did you notice? Any fall, anything before you notice that swelling, or just notice it at about that 8 months ago, sir?
Well, initially there was no pain, but in last few days I'm having more pain. Well, especially when I reduce the swelling.
Oh, so sorry about that. Oh, do you need analgesics, or we can continue because of the pain you are having?
No, thank you, doctor. Just go ahead.
All right, thank you. The pain, is it always present, or when you find it difficult to reduce that swelling, that the pain is present?
Yeah, so normally it's not there, but when I reduce it, because no, it just gets stuck, and when I reduce it, it starts having.
Sorry about that. The swelling, compared to when you first noticed it 8 months ago, has it increased in size, or the swelling is still small as it was?
Not really. I'm not sure.
You're not sure. Okay.
Yeah.
All right. Then this swelling that you're having, does it get to your scrotum, that is to your around your testicles, your scrotum, or it's just only at your groin?
No, it actually goes down to groin. Sorry, scrotum.
Okay, it gets to your scrotum.
Use layman language, please.
Okay.
Goes down, yes.
Okay.
The private parts.
Your private parts.
Yes.
Okay. Thank you, ma. Is there any time that you have vomiting, or swelling in your tummy?
No, not that much.
Not that much. Okay, but there was.
No, it's just a pain when I try to just reduce it. Otherwise, there's no any swelling.
Is there any swelling in any other part of your body?
No.
No swelling in any other part. Okay. All right. There was a time that you had problem with your water pipe system. What are those complaints that you had then?
I think I don't know. I had urinary infection a few times, but nothing else.
Okay. Okay. Was there pulse? Was there something like slime coming from your water pipe system? Then when you had...
No, it was just a pain when I go for wee, and then yeah, it came out to be infection. Otherwise, nothing special which I felt.
Sorry about that. Now, can you pass urine comfortably, or you have difficulty passing urine now?
Yeah, it's fine. It's fine.
It's fine. All right. Thank you. Then was there any time that your body was hot?
Mm,
That you have
not
fever?
really.
Not really. Okay. Um, are you losing weight or you lost appetite?
No, I've not lost weight.
Okay. All right. Sorry, I want to ask some question. You are a gym trainer. Since how long now have you been doing this job?
Sorry?
You are a gym trainer. Your occupation is a gym trainer. For how long have you been doing this job?
Yeah, for 10 years.
10 years.
Yeah.
Okay. Have you, apart from the urinary tract infection, is there any other conditions that your GP is treating you for?
No, I'm
No.
very active.
Do you take alcoholic drinks?
No,
Okay. What of smoking?
no, I don't smoke.
Okay. All right, sir. I want to ask, who do you live with in your apartment?
I live alone.
You live alone. All right. I want to ask you, what is your idea about your present problems?
Well, I think it's just swelling, and initially I thought it's just a swelling, but now I'm worried that it giving me unbearable pain.
Oh, sorry about that.
Ah.
Okay, so the pain is your concern also as well.
Yeah, mainly, yeah.
Then what is your expectation from us concerning this problem?
I just want to get rid of this pain and and the swelling as well, because it will give me again pain, maybe.
All right, thank you. Any cough or
Okay,
difficulty
can
with your
you
breathing?
present your history now, please?
Okay, ma. I've interacted with 33-year-old male gym trainer
Yes.
who has noticed right-sided groin swelling of 8 months duration. The swelling has not been increasing in size, but there is associated pain, which is has increased in intensity now and worse once patient tries to reduce the swelling. No, patient has previous history of urinary tract infection, but no problem with passing urine. No history of fever and no history of abdominal distension and vomiting.
Or weight loss. Okay, can you please, what are the differential diagnoses that you'll consider?
Okay, I'm considering inguinal hernia, right-sided
Okay.
inguinal hernia.
Yes.
My other differential will also include a groin, a lymphoma, and
Yes.
also a lipoma around that side could also be another differential, and then also a Schwartz abscess, ma.
Right. How would you confirm your diagnosis?
Yes, ma. To confirm my diagnosis, I want to do a clinical examination, so as to a detailed clinical examination as to know the nature of the swelling that patient has to make my diagnosis, and also do test also to confirm the diagnosis, ma.
Okay. Can you tell me, since your first primary differential diagnosis is hernia, so how does hernia takes place?
Okay, ma. Hernia is when there is a protrusion of a fiscus or part of a fiscus through a defect in the cavity containing the fiscus. So usually for the inguinal hernia, there is a weakness usually on the posterior wall of the inguinal canal. So that's where the swelling usually comes out from.
Okay, when do you think this patient will be fit to go back to his work as a gym trainer?
Okay, after surgery has been done, at least we need a minimum of 6 weeks to be off gym activities, ma, before he can return back to his work, ma.
So what are the management options that you can offer to this patient?
The management option includes non-operative management can be used, but for this patient that's already having pain, I want to do operative, which is we can do open reduction, open operation, which includes which involves the use of mesh repair. Then also laparoscopic method can also be used to repair the anemia.
What is the ideal condition when you can offer a patient laparoscopic hernial repair?
The ideal condition to offer laparoscopic hernia is when the
Patient
defect
has
is not
recurrent, yes.
the defect is not much, and then patient is not an obese patient, and his work doesn't involve doing strenuous activity that will make the having a high chance of recurrence.
Okay. Did you thank you, time has ended, so bell has gone. So it was good, you started off very well, but then what I wanted you to, since the stem says that patient has painful hernia and it is causing problem, does not get reduced itself, so I wanted you to ask about the pain. You asked about the pain, and if the swelling increases in size. Here you have to take two types of history, one of the pain and secondly of the swelling. Okay, so
Okay.
I don't think you covered the whole pain thing, because you didn't ask if the pain started suddenly or the gradually. What was the character of the pain? How would you grade the pain? Numerical from 0 to 10, or yeah, and the character, and if pain radiates anywhere. You did ask about the swelling, if it moves towards the, and then you have to, yes, use the layman language as well, that it moves towards the private parts, or it stays at the groin area, or etc. And it was not associated with the fever, and a patient was taking stamina tonic. So if you can tell me the constituents of stamina tonic, that can be asked. That you should.
Okay, I think stamina it's androgens, androgenic hormones.
All right, and when you were taking history from the patient, you did not ask if patient has recently traveled anywhere. So recent travel was also one. And then when I asked you about the management alternatives or options, you should have also said that you'll send the patient to the GUM clinic. What is GUM clinic, if you can tell me?
GUM.
Yes, GUM.
Okay, GUM, that's genitourinary.
And M?
Genitourinary medicine clinic.
Yes. Okay. Then you have to like send the patient there as well, and then you have to ask if there was anyone else in the family, because you didn't take the family history as well. If there's anyone else in the family who has a similar kind of problem. Yes. Anything else?
Okay.
Anyone else want to, Dr. Shoaib, do you want to give feedback? No.
Yeah. Well, for me, yes, ask almost all the questions. Yeah, you're right. Not typically pain questions, and he missed a few general parts of history, like family history, and didn't ask any details about the urinary tract infections much. He touched it, but not detailed one. Yeah, otherwise I think it's fine, because I was also not sure if it's just a hernia or tumor. I was myself confused, so otherwise I would have directed him.
Yes, but you have to know he's taking hernia counts.
Okay.
In the recall. So now, yes, thank you so much.